Hello and good morning, Sir Aziz. My name is FATIN binti JAMIL from BA2352C. And today, my group and I would like to present on the workforce density and distribution of registered nurses in Malaysia. Registered nurses are healthcare professionals who have completed an accredited nursing program at a university and are registered with the Malaysian Nursing Board, while also needing to obtain an annual practicing certificate from the Malaysian Nursing Council to be added to the register of practicing nurses in Malaysia. Besides, registered nurses can work in a variety of direct patient care roles outside of the clinical setting, such as healthcare consulting and education roles, as well as in any other specialized field in medical care. Furthermore, registered nurses are responsible for monitoring the patient's condition, assessing the patient's needs to provide the best possible treatment, observing and interpreting the patient's symptoms, communicating patients to physicians, and collaborating with physicians and nurses to develop effective individualized care plans for patients. Nevertheless, as a result of the COVID-19 pandemic that occurred in 2020 had a global negative impact in many ways. A number of issues have arisen involving the healthcare workforce, particularly registered nurses, regarding nurse shortages, workload, and burnout during the pandemic in Malaysia. Therefore, this matter requires careful consideration, and an appropriate solution must be devised to address the issue so that it does not worsen in the future. According to World Health Statistics, Malaysia has a higher nurse-to-patient ratio with a density of about 32.8 nurses per 10,000 people. The Ministry of Health Malaysia reported that there were 333 nurses for every 10,000 people in 2013. By 2020, there will be approximately 174,400 nurses employed, with a nurse-to-patient ratio of 1 to 200. According to the illustration, Sabah, Sarawak, and Terengganu are the three states that require the most registered nurses, with each of them needing 259,178 and 157 nurses respectively. This might be due to the migration of local nurses to the other countries, freeze in the requirement of registered nurses, and the unwillingness of the Peninsular's registered nurses to work in rural areas. Besides, Putrajaya and Kuala Lumpur have more registered nurses than patients. This might be due to the high population of citizens in both states, working and living condition, and the availability and distribution of educational institutions. The rest of the state has an almost optimal or suitable number of registered nurses based on the set ratio of 1 to 200 and the growth of population in the country.
Assalamualaikum and hi everyone, my name is SYAZWANI, BINTI FAUZI. I will be discussing about the issue. One of the factors contributing and resulting in changing workforce density and distribution of registered nurses in Malaysia is shortage of registered nurses due to a few causes that I will be discussed. According to the Ministry of Health of Malaysia, there should be one registered nurse for every 2 patients in the recovery room. For unconscious patient, the ratio must be 1 nurse to 1 patient. However, factors such as lack of university student admission, early retirement, excessive stress, low job satisfaction, lack of appreciation from superior, a diminished sense of value within the organisation, and unreasonable wages might contribute to registered nursing shortage, which then lead to reduced quality care and patient dissatisfaction. The impact of the nursing shortage is multidimensional and has a domino effect. The massive reduction in employment and understaffing produce difficult conditions and a strain for those nurses who remain on the field, where they are frequently pushed to work longer hours than recommended, resulting in tiredness, burnout, or lost experiences. As a result of this crisis, they are more likely to commit medical mistakes, affecting patient safety. For example, during COVID-19, about 90% of registered nurses decide to resign due to high level of anxiety and depression, prolonged work hours, and an unsafe working environment during the pandemic. To conclude, nursing shortage has a greater impact on the healthcare setting. Moving on to the recommendation of the issue, the first one is expanding the capacity of the domestic nurse education system to meet demand and to sustain long-term nurse supply. Many registered nurses are approaching retirement, and not enough nurses are pursuing career in nursing education to replace their retirees. Therefore, it is critical to encourage more people to pursue a career in nursing, which may then help in increasing the number of qualified applicants. Next is establish and sustain a healthy work environment. Emotional exhaustion, burnout, and compassionate fatigue were used to describe the stress experienced by nurses. In healthcare organization, ensuring the physical and psychological safety of nurses is the greatest priority. For example, by developing a caring culture and appropriate staffing strategy may result in a better work environment. This was proven by the research where job satisfaction among nurses was a key determinant of nurse retention. Last but not least is satisfactory wages. To promote the admission of nursing courses around Malaysia, salary rate and benefits should correspond to the skill level of registered nurses, attracting a sufficient number of people into this profession. That's all from me. Thank you.
In addition to a nursing shortage, workload and burnout among registered nurses have also been recognized as problems. According to a study, burnout affects 1 out of every 4 nurses. The amount of work that registered nurses must do and the standard of patient care are correlated with limited resources, a low number of nurses, and heavy workloads. The global healthcare system have been put under a great deal of strain by the coronavirus disease. The major factors that contributed to registered nurses burnout during the pandemic, according to a recent multi-country review that drew from 60 studies and 18,935 nurses, included longer working hours in quarantine zones, working in a high-risk environment, working in hospital with insufficient and inadequate material and human resources, increased workload, and lower levels of specialist training regarding COVID-19. Other than that, according to a study, younger nurses had a higher prevalence of burnout. This might be explained by the fact that junior registered nurses still need to practice their nursing techniques, which makes it take them longer to finish their work. Additionally, they might not be able to handle work-related stress with a resilience that comes from several years of expertise. In summary, burnout could eventually lead to a greater staff turnover among registered nurses if it is not effectively handled. Medical professionals and registered nurses may be more motivated and interested in providing care for patients, and burnout, depression, and overall well-being may be improved by motivational programs like appreciation events as well as professional identity development programs. Next, the numerous protocols aim at the standardization in the effort to eliminate errors and boost the overall quality of patient care are one of the expanding aspects of the work environment for nurses. Using HIWPS may allow nurses to take advantage of current protocol while still having the freedom to make crucial decisions that call for rapid action, helping them further accomplish their main goal of providing the best possible patient care. Moreover, although empowered workers are better able to handle stressful circumstances, such empowerment may need to be complemented by assistance from other nursing co-workers who are frequently closer to the stressor and can be more directly assist with any emotional or task problems they are going through. Additionally, empowerment can make it possible for nurses to actively seek out and use the right kind of support from their peers. Given this job interdependency, nurses view college support as a critical source of support, and providing support to one another can help prevent burnout.
To sum it up, following an examination of health workforce, supply numbers and trends that cause various issues such as the workforce shortage, heavy workload, and burnout among registered nurses, these have increased dramatically during the COVID-19 pandemic in Malaysia. Furthermore, it will result in registered nurses not being able to perform at their optimum level, the quality of work declining, working under pressure and stress, and working long shifts despite being depressed and burned out. Therefore, there are several potential solutions to the problem that have been identified, including increasing the domestic nursing education system's capacity to supply nurses in the long run and meet demand, creating and maintaining a healthy work environment, providing satisfactory pay, and implementing methods of encouragement and motivation to reduce nurse burnout and improve their mental health. That's all from us. Thank you.